So starting this month, the treatment center is now part of the code team for the hospital. So whenever there's a code that's called, the treatment center is expected to send 1 to 2 nurses to respond to the code. Since a code is like such a infrequent occurrence and a lot of people don't really respond to one, I thought it would be good to go over the different roles of a code team. Has anyone here ever responded to a code? No? Okay. Well, when you respond to a code, a lot of people show up. It's very chaotic because it's such an emergency, life-saving situation. So it's important that everyone know what their role is in order to help the code run a little more efficiently. There's an acronym that was created in order to help people remember the different roles in a code. And it's really simple. It's just A, B, C, D, E, F, and G. The A stands for airway management, and that person is going to be who establishes the airways, so like the physician or the resident that's doing the intubation, and then respiratory will come in and maintain the airway, and the person who's in charge of the airway will always be at the head of the bed. The next letter is B, and that stands for take a break. That's your alternate chest compressor. And then C is your compressor, so the B and the C will switch out every 2 minutes while they're doing chest compressions. D is for the defibrillation and med nurse. That nurse needs to stand closest to the IV and then closest to the crash cart also. And then E is the event recorder. That's the treatment center's designated role when responding to a code. And the event recorder needs to stand as close as possible to the med nurse so that there's clear communication between the two. F is for physician or code team leader, and they stand at the foot of the bed and just direct the actions of the whole code team and just ensure that the code's running as efficiently as possible. And then G is the go-to person. This is just an extra person that can go and communicate with the family or go and get other supplies and equipment as needed. So as I was saying, the treatment center's role is to be the event recorder. Anytime there's a code called over the intercom, the treatment center is supposed to send 1 to 2 nurses, and they must be ACLS certified in order to respond to the code. Upon arrival to the patient's room, there probably will be someone already recording things, and it's our job to go and ask them if that person would like you to step in, because it's likely that that person might have another role. They might be the patient's primary nurse, in which case they would need to be able to talk to the physician and the family about what's going on. We need to fill out this cardiopulmonary resuscitation record. It can be found on the crash cart, and it's pretty self-explanatory. You just fill in everything, anything that needs a checkbox, like whether the event was witnessed or not, whether it was respiratory, cardiopulmonary, or both. Talking about the airway, the circulation, and the outcome, and then this is where you would record all the medications and the times as well as the defibrillations that are delivered. Also on the back is a critique form. This needs to be filled out at the conclusion of the code, and then the whole form needs to be given to the house manager at the end of the code. And so I hope that this quick refresher will help you to feel a little more comfortable if you get called to respond to a code, and that you know what your role is and feel calmer in responding. Thanks.